Let's go.
Can we fire it up?
We're fired up. We're ready.
We're fired up.
Yeah.
Okay, well, welcome everyone for coming to this session on tech for health equity. So in this session, I'm going to do the government speech first. We're going to discover how technology, including AI, can advance health equity, bridging gaps in access care, outcomes to create healthier, more inclusive future for all communities. Okay, I'm going to paraphrase that because there are so many cool things that people see here at CES, and there's so many smart people here. But what's even more exciting is when people take that technology and figure out how to apply it to solving some of the really challenging societal issues. And that's really what we're going to talk about here today.
Yeah.
So a little housekeeping. So we're going to do about 25 minutes of discussion, and then we've got 5 minutes for Q&A. So think about your questions. You'll have some moments at the end if you want to get up and ask them. And I am here. Oh, first, I should tell you who I am. Hi, I'm Anna Banks. I'm Chief Marketing Officer for AARP, and I'm here with Damon Martin. He is one of those smart people out there. And in particular, he is an investor, a philanthropist, co-founder and CEO of WellWithAll, which is an innovative health and wellness company that pours significant portion of its profits into health equity. And we're going to do a double click into that health equity term. So welcome, Damon. I'm really excited to chat with you.
Yeah.
The first thing we wanted to do is we want to hear a little bit more about your personal journey.
So I'll just give you a quick breakdown, and I'll start all the way from the beginning because I think it gives context to where we are now. I was actually born into poverty. I was born in Columbus, Ohio. My parents got a divorce when I was in 3rd grade, and by 5th grade, actually my mom wanted to move for brighter horizons, so we moved to California, but it was during the height of the crack epidemic in Inglewood, California. And then she remarried to someone who ended up being a heroin addict. So I saw things as a child that kids should never see, but it's certainly given me perspective. My father moved to rural North Carolina, so I would go back and visit him every summer. And right before my freshman year in high school, I said to my father, I'm gonna die if I go to Inglewood High. And he said, well, come live with me. So I moved into a single wide trailer in rural North Carolina, traded the gangs for Confederate flags, but I lived. And ultimately, I got into UNC Charlotte, and that's where my life changed. I got great mentorship, became student body president as a sophomore, and really began to develop as a leader. My first job out of college was assistant to the White House Chief of Staff in the Clinton administration, and that also was just another level up for my life. Ultimately, I went to Harvard Business School and then joined Adage Capital just as it was beginning. And Adage grew from 0 to over $40 billion in assets. I was one of the managing partners there, investing in the consumer industry for 21 years.
Oh, you lost your mic. Other side. I think you got to bring it up closer to your mouth.
Is that how?
Here, we got you.
Show me how to do.
Can you all hear him now? Okay, awesome.
Ended up at Adage Capital. As one of the senior partners, was the only black partner in a major hedge fund for 2 decades. Yeah. And that allowed me to become a philanthropist. And my wife and I invested heavily in health equity and education to help folks in the best way that we could. And that journey was going well. And then 4.5 years ago, I was standing in the middle of an emergency room with somebody that I love dearly, dealing with depression, anxiety, and was suicidal. And that changed my life. That person was suicidal for 3.5 years, and we dealt with the tragedy of that every day. And what I realized sitting in an emergency room was that now I was on the other side of inequity, right? Where I had all these resources. I knew the CEO of the hospital. I could get access to every professional that we needed to give the resources that were needed. And it just showed me that there was more that was needed, because at 14, I was living in a trailer in rural North Carolina dealing with the exact same thing. I'd be dead or in jail.
Yeah.
And there's so many people in this country right now who are in that exact same position. So I actually retired from my investing position and started WellWithAll, which is a health and wellness consumer products company. and we take 20% of the profits of everything that we sell
Yeah.
and use that to impact health equity.
I love that. Thank you for sharing your journey. I want to do a little bit of unpacking of this term health equity.
Sure.
And make sure we do a little bit of level setting for everyone. Like, what is it? What does it mean? Why is it important to talk about?
I mean, simplistically, to be able to have access to healthcare when you need it, to be able to have nutritious food, to be able to see a mental health provider when you need it, to go into a hospital and, as a woman, deliver a child with in a routine way without the risk of death. I think that's health equity. And if you look across the country, where I live outside of Boston, there's a 23-year life expectancy gap between Back Bay and Roxbury. Those places are 3 miles away from each other, and in one area you're living 23 years longer, in one area you're living 23 years less. Your zip codes shouldn't determine your lifespan.
Yeah.
And so there's an inequity that exists in that context that we're working to impact.
Yeah, that your zip code shouldn't determine your health outcomes. Like that's pretty impactful there. Okay, so we talked a little bit about some of the gaps and a bit about wherewithal. Let's get into how technology potentially can help bridge some of these gaps. Where is AI making a difference? What do you see?
Well, since we're here and we've got these incredible partners in AARP. AARP is certainly one of them, and M&T Bank is another. Today, we're actually announcing that we're launching the $1 million WellWithAll prize. And so we're going to give away $1 million. Thank you. We're going to give away $1 million, and we've seen innovation all throughout here as I've been walking the halls. And AI is this powerful force that can be used for good. And so we're going to invest in companies, they're grants. We're going to invest in companies and help give mentorship. We're going to help give the ability to scale ideas that are greater than ideas, actual impact that can close health equity gaps. And so you guys are hearing it first.
I love that. I love that. I mean, there's so many ways that technology can really help bridge some of these gaps, making forms easier to fill out so people have access to public benefits. So I also want to do a little bit more digging into WellWithAll.
Okay.
Tell me a little bit more about like the impetus for its founding and how it works and some of the work that it's doing and how that led to this amazing offer, the prize.
Well, I mean, so the whole idea is to have an economic engine. We don't, there's not enough tax dollars, there's not the political will, there's not enough philanthropic dollars to actually solve all of the societal problems that exist. And so capitalism has to take a role in that. I mean, there's been some great examples where Newman's Own and Patagonia and many others have used their ability to take a portion of their profits to drive it into helping society. And WellWithAll is a 2.0 version of that. We have, this incredible energy drink right here. And we have a whole line of nutritious items that actually the 20% of the profits of everything that we sell go to impact these societal efforts that we're engaging in. And it's a different model, but self-interest is essential, but selfishness is not.
Yeah. So I've heard you use this phrase, no money, no mission.
Yes.
Can you tell folks what that means and how that fits with what you just described?
No, you have to have profit. I mean, profit is essential to be able to drive, these impact efforts. So it has to be a sound business model to drive the change. If you don't have dollars, you can have all the greatest intentions in the world, but if you don't have the dollars to fund them, then you don't have any movement.
Yeah. What do you think have been some of the barriers to those dollars funneling into the right places and even the technology filling those gaps?
I mean, look, philanthropy can be an ego-driven exercise. And so everything that we've engaged in, we've worked with some of the greatest experts, in the world to ensure that the help that's actually needed is actually being driven. So, we've created these toolkits that have democratized health information and we're using that to get people information that they need to live longer, healthier lives.
Yeah, that's great. Thank you. Um, let's talk about the ecosystem that is around this, the inequity. And can you talk a little bit more about that?
Wait, say that question one more
The,
time.
the ecosystem, like, so we've been the ecosystem reality check, as we have been calling it. So the gaps that there, the need for more strategies and to address the fear and mistrust of AI in communities.
Oh, the fear and mistrust of AI. Look, I mean, like any powerful entity or exercise, it comes, you have to have consciousness, with that. And so we've heard so much about the fear, the data that is training these models, the mistrust in understanding how the technology actually works. But there's also some really great things about the power of AI, and you got to have the right set of experts around you, which we do, to help make sure that this is a sustainable exercise that is driven by morality.
I was going to say, so let's talk about the flip side.
Yes.
What are some of the principles that you think really need to be applied to make sure that there's responsibility and ethics in the way that AI is used and applied to social challenges?
Yeah, I mean, there's incredible experts that have studied this much more so than I have, and we have some of those on our team that are ensuring that we're thinking about access, that you don't have to have the latest model of the greatest phone to be able to engage with the models that we would use. In fact, how the information and data that we're pulling from is inclusive in nature, and is thoughtful in the way that we gather it. I mean, that's one of the biggest pieces, that there can be inherent bias in age, in ethnicity, in mobility, in how the decisions are made. And so we're making sure that we're taking the steps to take that into account.
I love that. Let's talk a little bit more about this prize.
Yes.
Because that is the exciting thing. What are you looking for? What are some of the mechanics around the prize? How are you going to measure sort of long-term success around it?
Well, we're not looking for just ideas. We're looking for actual impact. So any winner of the prize would have to already demonstrate that they're already impacting a population of at least 1,000 with the ability to scale to 100,000 over 3 years. So we're thinking about true scale, true impact, not the beginning of someone sketching something on a pad. And then also that you can use this with a simple cell phone, and again, not need robust technology. We want this to be inclusive as possible.
To actually apply some of these principles that we were talking about,
That's exactly
and not just perpetuate some of the inequity.
Exactly right. Because this technology could drive greater divide, or it can drive greater impact, and we're leaning towards the latter.
Yeah. I'm curious, are there some other players in the space that you feel like that the audience should know about that are starting to lean into things like this?
Look,
or partners
I think
that WellWithAll looks to work with?
Well, I mean, Anthropic is doing a great job of being thoughtful about how they gather data, how they train their models, how they use information. I mean, that's a great gold standard for how we're thinking about some of these pathways. But the beautiful thing is there are ideas that we are not aware of, that this incentive, that this $1 million of prize money will bring people to the forefront to think about health equity in a way that they might possibly haven't before this incentive. And that's the beautiful thing, because without the dollars, right, like, people have to function in a variety of ways, but we're helping that.
Yeah. I mean, what's your dream? What's your vision for the future? Paint a picture for me of, like, when we are able to move towards more health equity, what does it look like?
So again, if you look at the 23-year life expectancy gap that exists in Boston, if you look at the 30-year life expectancy gap that exists between the north side and the south side of Chicago, having those gaps materially close as a result of the innovations that we help fund and scale, I mean, that's the dream.
Yeah. Yeah.
And that's going to be the reality.
What is the inspiration? So I want to make this one of my last questions. So all of you, hopefully you're starting to think about questions that you might have for Damon. What's the inspiration that you want to leave technologists and entrepreneurs so that they can go forth and figure out how they can apply their talents to health equity? Like, what would you tell them? What do you want them to do?
So what I would say is very clearly, if you look from 2022 until now, on average, 17 veterans a day have committed suicide. If you look at rural towns across this country, roughly 140 rural hospitals have closed since 2010. And you look at the disparities that have existed in society for so long, and they continue to be perpetuated over and over and over again. There's an opportunity for us to live, all of us, longer, healthier, more joyful lives. And if we look at the picture of that being our society, I think that that's an inspirational goal that these great and brilliant folks, many of whom that are in this room and at this conference, should look towards as a point of inspiration.
Yeah, I mean, that longer, healthier, more joyful lives is like all, that is what AARP is all about.
That is what AARP is all about. We want to dance, we want to sing.
and for more, better years, within the next 5 years, there will be more Americans who are over 65 than are under 18.
Yeah.
And more of us are going to live to over 100. And so the more things that can make more of those years like really valuable, active, moments, like the better.
I'm going to be a very cool 100-year-old. Like, I know that for a fact.
And actually, it's if those of you who have not already been through the AgeTech Collaborative space, there are a lot of very cool things in there that will help enable all of us to be more active, like augmenting our vision, our mobility, and so that's a pretty cool thing.
Yeah.
All right. Well, so if there are questions, folks, please come up to the microphone. We would love to hear from you and ask Damon some questions about the prize or WellWithAll.
Just given your perspective in terms of thinking about the health equity and the drama from 4 years ago and how people access information and quality care, without saying which prize is going to win or how you're going to judge it, is there a specific technology or information ecosystem that you are favoring or that you want to see developed because you think it'll have a greater impact?
I think that's actually one of the problems with philanthropy, is that we try to drive how the solution comes about. And there are folks who are thinking about how to use this technology in a way that I never have. And so we're giving some guardrails and parameters, and we're going to see the great things that bubble as a result of that.
Very nice. Thank you.
Thank you for your question.
Yeah, great question.
Yeah.
I see I have another question coming up.
Hi, thank you so much for the wonderful discussion. I'm super excited about the prize. I did have a question around families. So a lot of the impact that we've been talking about with respect to health equity is usually about patient outcomes, but patient outcomes have a very real relationship with the the coordination, the navigation that the family helps with care, and that changes drastically as you look at different types of populations, different cultures. So I'm curious as to your thoughts of how the family, the caregiver weave into not just the prize, but how this is going to change.
They're essential, right? And so sometimes you can get hyper focused on a very specific aspect of the solution. We're talking about the entire ecosystem. So we're looking, that's why we're making this judgment based on impact. So a caregiver's, rest, their ability to interact, here's a really great question that was posed to me. It's like, your health being at tip-top shape, who wins as a result of that?
My kids.
Yeah, your kids and other family members, right? So there's so many people that win as a result of you being taken care of you being healthy, of you being a center part of the ecosystem. And so we'll take that into account as we're looking at this prize. So it's an excellent question.
Yeah, I love this question. I love the idea of thinking about it as an ecosystem. To your
Yeah.
point, it's not just about solving the individual, because often when you buttress the individual, you buttress all the people around them, because
Correct.
often they're needed to.
Well, and
support as
it's,
well.
understanding social determinants of health, right? So
Yes.
it's not just the medicine that someone is taking or the exercise, but it's like, are they housed? Do they have food, right? Like, do they have access to a doctor? And so there are all of these things that actually end up impacting someone's longevity. One of the greatest impacts of longevity is actually community,
Yeah.
friendship,
Yeah.
engagement. And so, again, understanding all of these inputs is a critical piece of the puzzle.
Yeah, that interconnectivity is a critical part.
Thousands.
You raised this friendship piece, and there's a stat that we heard last night that social isolation has the same impact as smoking 11 cigarettes a day.
Yeah.
Like, it has that level of impact on your health. You've written a book about this.
Yeah.
Do you want to talk a little bit about friendship and some of the things that you uncovered in putting
So
it together?
I've written my first book, Friends of the Good. It comes out March 31st, but you can actually buy it on Amazon right now. There is this false narrative that successful business people pull themselves up by their bootstraps.
Yeah.
And the reality is like no one is successful on their own. There's been so many people throughout my life that have been impactful to me just at those moments when I really needed the help, the advice, the context. And so Friends of the Good talks about the context of Aristotle broke down friendship in actually a really interesting way. He gave it in 3 categories, being the most essential element of joy, transactional, right? You scratch my back, I scratch yours.
Mm-hmm.
Friends of pleasure, we go out and we party and we hang out together. But the problem with those 2 kinds of friends is they're fleeting in nature. When the transactions go away, so does the friendship. When
Yeah.
when the pleasure goes away, so does the friendship.
Yeah.
But friends of the good are friends of valor. And those are individuals who have a commonality. Like I've met you, it seems like I've known you for 20 years because we have so many things that we value in the same way. Those are the types of friendships that last for a lifetime. And I talk about several of my friends of the good that have impacted my life. And in this time of loneliness and despair that so many people are suffering from, how to identify, how to engage, how to think about the people that you really want in your life. I've got this phrasing, show me your friends, I'll show you your future.
Mm-hmm.
Because who's around you, who is in your ecosystem, those are the folks that determine what your life is truly like.
Yeah. I would love to then bridge. So we kind of talked about 2 sort of disparate things, right? We really leaned into technology. How can technology, help bridge some of these health equity gaps? And then we talked about this kind of more soft skills, relationships, how that can really buttress health. How do we bridge those 2 together? How do we bridge the friendships and social connections with the discussion around technology?
I think with everything, you have to take into account humanity. You have to take into account the softer side of life. If you make decisions purely based on just the data or purely based on just the productivity, you miss out on the ability to create something special and wonderful. And I mean, that's at the heart of WellWithAll. It's in the name, WellWithAll. We're trying to help everyone that we possibly can live a fuller, healthier, more joyful life. And when you think about how you approach people, how you approach life, how you approach business in that way, I think you win.
I love that.
That's pretty damn good. I didn't even come on.
Okay, so we're on a high. I want to take us down a little bit, and then we'll come back up.
Okay.
It can be pretty challenging, I would think, driving a mission-driven organization. Tell us about some of the challenges in sort of bridging the 2, like trying to drive profits, but also drive mission at the same time. And maybe you'll say it hasn't been a challenge, but it feels like you're kind of bucking the current of how business normally works. And so how has that been challenging, and how have you kind of survived
It actually has been an accelerant.
Really?
Yeah.
Okay, say more about that.
Because if all you're thinking about is the thing, the profit, this thing right here, that's not a driving force to get the best people in the world to come and work with you. And right, everyone that works at WellWithAll, we're thinking about how we're impacting society. We're thinking about putting $300 million into health equity over the next decade, and that bonds us in a way that makes me work an extra hour in a way that if I was just making a widget, I wouldn't care about.
Yeah.
But I care so deeply about the impact. It's actually driving the capitalistic piece of the business in a greater way.
I love that.
It's a superpower for us.
I love that. So then what's your call to action even for more people or even to our audience? Like, how should they even be thinking about that? How could you apply that to your life or your purpose?
I mean, everybody doesn't have the time to stand up a capitalistic enterprise and a foundation at the same time, or even go in and work and engage. But like every time that you pick up a WellWithAll product, you're actually contributing to this movement, to this journey, because 20% of the profits is going to impact the things that we're working on. That's a simplistic way to engage, but we have many other ways that if you go to the wellwithallfoundation.org, that you can join this movement in a wide variety of ways, because we're trying to impact society in every way that we possibly can.
I love that.
Yeah.
All right. Anything else you'd love to tell us about this journey with health equity?
The thing that I would say to everybody sitting here and everybody listening is people need help right now. And there's something that every person in this room incrementally can do to help make this a better place to live. And so I would just encourage you to do that. That's all I got.
All right. We got any other questions out there? Oh, we got one more question. Yes, thank you.
Hi.
Hi.
So one of the things, I work at a nonprofit in New York City, New Jersey, California.
Which one?
YAI. We work a lot with people with intellectual disabilities of all ages, ethnicities, zip codes. It's a real problem, even in that population where people are living in Long Island as compared to the South Bronx, the health disparities which exist.
Yeah.
We are trying to answer those. We have clinics funded through Medicaid, not the most reliable partner in making those services happen. But we try. But for most nonprofits which are doing this work, and we are in the HCBS space, which is big with AARP, we are there. We are social workers primarily at heart. That is what we want to do. And most people who get into this work want to do that. I don't think we have the bandwidth, firstly, fiscally, or the knowledge to make our processes more efficient. And we provide services in San Jose, right in the heart of Silicon Valley. eBay's got its corporate offices right across us. But when we deal with government, it's still a very process, inefficient, heavy labor-intensive way.
Is there, you got a question in
Yes,
there?
what I'm
You gotta
saying
get
is
some
I
framing.
don't think we have the ability to get many of the things that private enterprises do to make our processes faster, quicker, make them more efficient.
Okay.
And having some kind of an AmeriCorps kind of a thing to create that, fund it so that they can work with nonprofits, and there are thousands of nonprofits across the United States, which could really benefit and free up dollars to be able to have a bigger impact. Because as you said, there are going to be more people over 65 than under 18. Where's the workforce? For IDD folks, where's the workforce? For people who are aging, where's the workforce? How do we free up many of those dollars and processes? I think is something you and your foundation might want to think about, is how do we create that so that other nonprofits can be smarter and better at doing this?
I thank you for the question. I would say a couple of things. One, this whole ecosystem of problems is tremendous. And if I thought about all of the problems that existed just in health equity alone every day, I would ball up in a corner and not do anything.
We all would.
But what I've chosen to do And I think it's just the advice that I also give other people is to focus on what you actually have an expertise in and can control, and run really hard at that and bring other people along to do the same thing in other areas. One of the problems that does exist in the philanthropic world and in the nonprofit world, quite frankly, is that there is this unwillingness to actually consolidate resources. So many folks are replicating the exact same work in the exact same city and not working with each other because of the philanthropic desire and need to raise their own $1 million every year. And so therefore, who's losing? Society, right? And so the problem that you raise is one of the problems, but it's not the only one.
Yeah.
And so I want you to keep running really hard at what you're doing, but also I would also give that advice in terms of, are there other places in your ecosystem that you can partner with and be effective together, such that the splintering, that happens throughout the nonprofit world can stop. But I thank you for your question, and it's something that I will consider. Thanks.
Yeah, and with that, I think that's a mic drop. So, Jaman, I want to thank you for joining us today. I want to thank all of you for joining us for the discussion. Follow WellWithAll. If you are interested in the prize, definitely submit something, and thank you all for joining.
Thank you. Thank you very much.